Did you know that every 66 seconds, someone in the world is diagnosed with dementia? It's a terrifying thought, and for a long time, we've mostly blamed aging. But what if one of the biggest culprits is hiding in plain sight, right inside your medicine cabinet? What if the very pills you take for allergies, sleep, or heartburn could be quietly shrinking your brain's memory centers? New research is sending shockwaves through the medical community. It shows that some of the most common medications prescribed to older adults can significantly increase the risk of dementia by up to 49% in just a few years. It's a silent epidemic of drug-induced cognitive decline, and today we're exposing the truth. We're going to count down the 9 most dangerous medications linked to rapid memory loss, ranked from commonly overlooked to the downright devastating. All of this is backed by solid scientific studies and will explain exactly how they damage your brain. Stick around because understanding this could literally save your mind. Let's start with number 9, Diphenhydramine. You take it to stop a runny nose or to get some sleep, but here's the problem. Diphenhydramine is a powerful They work by reducing stomach acid, but they also seem to interfere with how our bodies get rid of a protein called beta amyloid, the same sticky protein that forms plaques in the brains of Alzheimer's patients. If you're on these long term, it's crucial to talk to your doctor about the risks. It's not about stopping statins, but about being aware and discussing any cognitive changes with your doctor. There might be a different type of statin that works better for you. Now we're getting into the heavy hitters. At number 5, benzodiazepines. These are drugs like Xanax, Valium, and Ativan, often prescribed for anxiety or insomnia. They are highly effective in the short term, but long-term use is a different story. Multiple large-scale studies have found a strong association between prolonged benzo use and an increased risk of Alzheimer's disease. The longer you take them, the higher the risk. These drugs are meant for short-term crises, not for nightly use over months or years. Their sedative effect can also directly impair memory formation and recall day to day. At number 4 is Amitriptyline. This is an older type of antidepressant, also used for nerve pain and migraines. And guess what? It's one of the most potent anticholinergic drugs on the market. Remember the JAMA study? It specifically called out drugs like this as having the strongest link to dementia. Right behind it, at number 3, is another antidepressant, Paroxetine, sold as Paxil. This dual action makes it particularly risky for cognitive health in seniors. If you're taking Paxil and noticing memory issues, it's not just in your head. It could be the medication itself. Discussing a switch to a different SSRI with your doctor could make a world of difference for your brain clarity. They come with a black box, warning the FDA's most serious about an increased risk of death in elderly patients with dementia. Their use should be carefully monitored and reserved for only the most severe cases where other options have failed. This isn't a single drug, but the devastating effect of taking multiple anticholinergic medications at once. Imagine taking a bladder drug, a PM sleep aid, and an old-school antidepressant. Together, the effect isn't just added DITs multiplied. Your brain is being starved of acetylcholine from multiple angles. This is the fast track to drug-induced dementia. A pharmacist can review your full medication list to spot this dangerous combination. The most important takeaway here is that much of this drug-induced cognitive decline is reversible. Ask them, could any of my medications be affecting my memory? Demand a medication review. Protecting your brain is the key to maintaining your independence and quality of life. We want to hear from you. What medications are you taking? Have you noticed any brain fog or forgetfulness? Let us know in the comments below. We read every single one and will do our best to share helpful insights. If you found this video valuable, please hit that subscribe button and turn on notifications. We're dedicated to bringing you science-backed knowledge to help you thrive after 60. Thanks for watching.